One is to support the patient with the disease and you know, try to understand and meet their needs and become educated on the disease process. I think in the current society it's easy to get educated with the access to internet and everything else, that you can get a lot of information. Now a lot of the information is good, some of it's not as good. Filtering that through your physician would be a good idea to do, but I think becoming as educated as you can in the disease and how it's going to affect the patient is one of the best things you can do. Well, it's important to understand and to feel comfortable with the physician that you go to be able to talk to your doctor and tell them the symptoms that's going on. And it's also very important, if you have a history of asbestos exposure, to tell your physician about that, because there's a variety of diseases related to that, mesothelioma being one of them, and it's important for the physician who's taking care of you to know that history. So in the process of telling them about your current problems, a past exposure history is very important, particularly the exposure to asbestos. I think in a disease such as mesothelioma, which is a fairly rare cancer that people get diagnosed with, it's important to make sure you see somebody who takes care of that disease process. And so if you're seeing a general practitioner, which can take care of many different problems, there's no problem in getting a second opinion. In fact, it's commonplace in medicine to get second opinions. And any doctor, no doctors are going to feel threatened by you getting a second opinion. It's important to understand and to communicate that with your physician, though, and say, you know, because I have this disease, and not that I disagree with anything, or I just want to talk to somebody else about it. And often it makes people feel more comfortable when they hear, you know, maybe a similar thing from two different physicians. But it's very important, I think, to explore all of your options and to, you know, maybe get a second opinion from somebody who's more specialized in the area, or just from another physician. Mesothelioma, many physicians, a regular oncologist that you see, and it might be in your community, can treat you with kind of the basic chemotherapy. But I think a lot of the more aggressive therapies, as well as the clinical trials that we've talked about, it's important to go to a specialist who deals with patients with mesothelioma often. Some of the surgeries, the aggressive surgery like the extrapleural pneumonectomy, there's not many surgeons that do that procedure, and there's certainly not many that do them often. And so it's important, if you're going to get either on the drug therapies or the clinical trials or the more aggressive surgeries, to see a subspecialist who deals with patients with mesothelioma often.